Good afternoon, everyone. My paper is Dry Eye and Meibomian Gland Dysfunction in patients of allergic conjunctivitis in a coastal area. There are no financial conflicts of interest. Allergic conjunctivitis and dry eye disease are highly variable and two most common ocular surface inflammatory disorders. These disorders have been regarded as the epidemics of the 21st century, affecting the quality of life of people. Results of quality of life studies have shown that the impact of moderate to severe dry eye is similar to that of moderate to severe angina. Why this study? Dry eye hinders the removal of allergenic antigens on the ocular surface, which exacerbates allergic conjunctivitis. Similarly, allergic conjunctivitis has been shown to disrupt the tear film stability, contributing to worse outcomes in patients with dry eye. These negative interactions between the two diseases necessitate bidirectional diagnosis and management to prevent chronic damage to the ocular surface. Aims and objectives were to study the prevalence of dry eye in clinically diagnosed patients of allergic conjunctivitis, to study the prevalence of Meibomian gland dysfunction in patients of allergic conjunctivitis. Material and methods, it was an observational cross-sectional study which is conducted from June to July 2023, and 32 patients having the chief complaints of itchiness and redness in the eyes were included in the study after taking proper written informed consent. In pediatric patients, consent was taken from the parents or guardian. My inclusion criteria were the clinically diagnosed cases of allergic conjunctivitis having the chief complaints of itching and redness aged from 7 to 60 years. Exclusion criteria were the patients on any topical medication, history of contact lens wear, history of refractive surgery or ocular surgery, history of ocular trauma, corneal pathology, systemic diseases like diabetes, collagen vascular disease, hypertension, and on medications like immunosuppressants and isotretinoin. My methods of evaluation consisted of OSDI score, Shermer-1 test, TFBOT, and slit lamp evaluation for Meibomian gland dysfunction. The following were the results. The male to female ratio was 12 to 20, so females outnumbered males. Perennial allergic conjunctivitis were contributed to 28.12%. Seasonal allergic conjunctivitis patients were the maximum, contributing to 53.12%, and VKC was 18.75%. Coming to OSDI scores, 18 patients had normal OSDI scores, 10 had mild dry eye according to OSDI scoring, and 4 had moderate dry eye. The mean OSDI scores was found to be significantly higher in patients of perennial allergic conjunctivitis with a mean of 20.33 plus or minus 7.22 standard deviation, having a statistically significant p-value of less than 0.001. And according to TFBOT, 25% patients had dry eye, having a TFBOT of less than 10 seconds, which included 4 patients of perennial, 3 of seasonal, and 1 patient of VKC. According to Shermer-1 test, 10 patients had dry eye, having a value of less than 10 millimeter in 5 minutes, which included 5 patients of perennial, 4 patients of seasonal, and 1 patient of VKC. Coming to Meibomian gland dysfunction, out of the 32 patients, 11 patients had associated Meibomian gland dysfunction, out of which 4 patients had grade 1, 5 had grade 2, and 2 had grade 3, out of which 7 were of perennial allergic conjunctivitis. So my outcome was allergic conjunctivitis was found to be more common in females, and seasonal allergic conjunctivitis was more common. Perennial allergic conjunctivitis has a higher prevalence of dry eye, followed by seasonal and then VKC. And in our study, out of 32 patients, 10 had mild dry eye disease and 4 had moderate. Meibomian gland dysfunction was significantly found in perennial allergic conjunctivitis patients at a 77.78%, indicating its association with the chronicity of the disease. The limitations of our study were it was a cross-sectional study, not longitudinal, had a small sample size, duration was small, and meibography was not done. Coming to the discussion part, TFOS DWS2 criteria has identified allergic conjunctivitis as a probable risk factor for dry eye disease. Similar findings were found in other studies of seasonal being the most common. Mazumdar et al. Had a similar inference of perennial allergic conjunctivitis having a higher prevalence of dry eye. Prevalence of dry eye in our study differed from other studies, and this decrease in prevalence could be due to climatic variations as our region had high humidity. Conclusion, ocular allergy contributes to tear film hyperosmolarity, ocular surface inflammation and damage, all of which are key mechanisms in the vicious cycle of dry eye disease. Meibomian gland dysfunction is a major long-term complication of allergic conjunctivitis. The inflammation response and continuous mechanical stress induced by chronic eye rubbing in allergic conjunctivitis are presumed to be associated with the onset of Meibomian gland dysfunction. Therefore, allergic conjunctivitis patients need to be screened for dry eye disease even after the resolution of symptoms, and associated Meibomian gland dysfunction needs to be treated in order to improve their quality of life. Thank you, everyone.